So I'm Marion Walker. I'm Professor of Stroke Rehabilitation Research at Nottingham University in England. So home visits are often an intervention that is delivered sometimes as policy in certain stroke units in order to assess the safety and the independence of that individual when they are discharged home. So it's around taking the patient out and assessing heights of beds, whether they can get on and off the toilet, the very practical activities of daily living. That's reassuring for the carer, reassuring for the patient, and also reassuring for the staff discharging them from hospital. And in my lecture, I've looked at the evidence that's available for this, and essentially this is a common practice with not a lot of evidence to support it. And what we want to know in our research is what is the best way to do this and what is the most economical way to do it. Is it by physically taking the patient out to their home, or is it by interview and by discussion? Can you get the same information at a smaller cost? And does it prevent falls and the safety of the patient? So that's what my lecture will cover in home visits. So patients actually feel relieved that they're getting a home visit because then they know that discharge is imminent. Stroke survivors, like any patient, want to be back in their home environment. Clinicians, there's a bit of equipoise in that some clinicians think they're very useful things and other clinicians think that the time could be spent better actually doing tasks with the patient in the hospital. So there's a real mixed opinion on the benefits of them. They're very time-consuming activities. The average home visit takes approximately 4 hours to conduct, from planning the visit, taking the patient out, travelling to the visit, writing the report. So overall, it's a time-consuming activity. So early supported discharge is an initiative that started in the 1990s, and it is aimed to get people, stroke survivors, out of hospital earlier than ever before. So a discharge round about as early as 3 to 4 days after stroke. The crucial point about early supported discharge is that stroke patients and their carers must have the same intensity of intervention in their home environment that they would have had in hospital. And that may mean having clinicians, having therapists into the home up to 2-3 times a day. So it's a very intensive service. There is robust evidence from this from more than 12 trials across the world, saying that it reduces, it expedites people's discharge from hospital with a mean of 7 days. It saves a considerable amount of money, and it doesn't compromise functional recovery, plus patients like to be rehabilitated in their own home. So there's very strong evidence, and certainly in the UK, patients are encouraged to be discharged early, but we need to know that the services are delivering what the evidence base says that it should be delivered. And in many services, they fall short. So it's around making sure that patients get the intervention that early supported discharge is supposed to deliver. So community rehabilitation is very important because patients are being discharged from hospital earlier than ever before. The main thing is that the patient is comprehensively assessed and they receive the services that they need. So if it's a mobility problem, the physiotherapist will need to be involved. If it's a functional problem with an activity of daily living, the occupational therapist needs to be involved. Similarly, speech and language therapy, or cognitive difficulties, the psychologist as well. So it's important that there's multidisciplinary team working in the community as well as in hospital rehabilitation. So it's about getting the services that the patient needs at the time that they need it. And also that patients are assessed on a follow-up basis to identify any ongoing needs that they have. and also to link in with social care and to link in with the voluntary sector. So severe stroke is a problem for every stroke service. How do we best manage severe stroke? And in my opinion, we have a long way to go before we actually know the best pathway for severe stroke. Often they get discarded in services, and we know from the stroke unit literature that every patient will benefit from stroke and from stroke rehabilitation. So there's approximately about 20% of strokes are severe strokes, and many are discharged very quickly into care homes where there is very little rehabilitation, very little support for ongoing stroke problems. Yet in care homes, the large majority of patients have suffered a stroke. And there's an issue around carers in care homes fully understanding the problems of stroke, such as cognitive and perceptual problems that follow stroke. So it's a very large problem, severe stroke, that I think we need to do a lot more research in to understand it more fully and to deliver the best care possible. And there's a lot of severe strokes with dementia as well, which compound the problem.